Stigma and discrimination plays a huge role in how people access healthcare services, especially HIV-related services in Jamaica. For example, the HIV cascade in Jamaica, it shows over 30,000 people living with HIV, but there's a fall off as you continue, whether it's accessing services to viral suppression. And across that line, you recognize that stigma and discrimination is really the main thing why a lot of persons are not where they're supposed to be. We believe that as long as we exist, stigma and discrimination is something that we'll continue to fight in all our programs, in all our services, in all our interventions with people living with HIV and with the general community, because we need to ensure that people know about HIV so we can dispel some of the myths, so that we can have people using condoms, so that we can have people being on medication and being virally suppressed. So yeah, it's a huge problem.
There was a young lady who was empowered enough, and she knew of her HIV status. She was in a relationship with her partner, and they wanted to have a child. The doctor was the person who actually was saying to her, "You are wicked," and making the lady feel like she's less of a human being. And what happens to her one time she died and leave this child there. And she said, "But my partner is aware of my status, and we both decide that we want to have a child." And the lady decided, okay, I know what I know, and I know about JADS. I'm going to make a complaint to JADS, which she did make a complaint to JADS. And the case was investigated. It was sent to the Ministry of Health. The thing that was done was that there was a intervention with the healthcare workers and the complainants, and an apology was given to the young lady in the intervention, and also there was also a signed form to say that she's satisfied with the redress that she received. So we thought that was a success, because if she did not make that report, another person maybe also be going through the same thing that she went through. And I think the doctors have been going through regular trainings to say that if when persons come to you are HIV positive, this is not how you're supposed to deal with them. You deal with them as somebody who's a normal person, and also don't infringe on their sexual reproductive health rights.
So the future is this for us: 0 AIDS-related deaths, 0 new infection. That's what we want as an organization providing services for people living with HIV and living positively. That is important for us, and we'll continue to do that work whether there is large amount of funding or small amount of funding, because we're still going to operate from our core, which is to advocate for the rights and concerns of people living with HIV.